The Speaker, today we're going to do everything we can to try to stop this from becoming law. And the Speaker, to work with us in a bipartisan way to enact common sense, step-by-step reform to make health insurance more affordable for more Americans.
Good morning. As a leader suggests, there are just a lot of questions being asked about why would we be proceeding down the path today to pass this trillion-dollar overhaul of our health care system. And one of the instructive points is to look to see where the bipartisanship really is on this bill. And if you look at it, the bipartisanship is in opposing the Democratic bill on the floor. Here's the first 21 Democratic votes that are going to join us in opposition of the Speaker Pelosi's bill. And I am sure there will be many more Democrats than just this 21 that will be voting in opposition to the Democratic bill. I believe that's the case because many members on both sides of the aisle are listening to the voters who spoke last Tuesday in Virginia, New Jersey, and across this country in local elections, state and local elections. The message was simple. People have a grave concern about what Washington is doing to them, not for them. And if you look at what goes on the floor today during this health care debate, there are two very distinct visions of the way forward for this country as far as health care is concerned. There's one version, as the leader just pointed out, represented by the majority's bill, which will put the government between patients and their doctors. The Republican version, which won't. There's one version that will impose higher taxes on small businesses while we're expecting them to create jobs, and there's a Republican version that won't. There is one version that will be a massive overhaul and remake the health care that we know into a system that we don't. And there's another version that takes a much more reasoned and smart approach to preserving what works in the system while trying to address what doesn't.
All week long, the Republican women have been listening to women all across this country regarding health care reform. Because in most American families, it is the woman that makes the health care decision, whether she's a spouse, whether she's the mom, or whether she's a daughter. We spend out $2 out of every $3. Women are also the majority health care providers, the health care professionals in this country. 98% of home care aides, 90% of nurses, and 50% of first-year medical students are women. And the message we're hearing from women about this health care bill is that we need to slow down and get it right. Like Mom used to say, you rush and you make mistakes. We think Speaker Pelosi is rushing to pass this bill, and it is the wrong legislation for women. The cuts to Medicare are going to hurt women more than men. The cuts just in Medicare Advantage alone, 4.6 million women will lose their health insurance. The restrictions on treatment options are going to disproportionately impact women. This is the wrong approach. Let's slow down and pass reforms that will actually help our families.
Good morning, Kevin Brady, Ranking House Member of the Joint Economic Committee. We developed this chart based on Nancy Pelosi's new health care plan. We developed the original chart that showed 31 new federal agencies, commissions, and mandates in between you and your doctor. The new chart shows more than 90 of these new mandates, commissions, and agencies. The true number is well over 100. We simply ran out of space. In terms of sheer bureaucracy, if the IRS and Medicare had a baby, it would look like this. And the question is, how is that going to make our health care more affordable? The truth of the matter is, while we've read this bill and we've identified all these new pilot programs, new grants, new commissions, new financial entities, and new demonstration projects, all which are inside the boxes tied to the original chart, the truth is no one really understands how this health care bill will work, especially the doctors and the patients who are going to have to live under it.